We are back now with a GMA3 health alert. The FDA has just approved the first and only treatment for low libido in women who have gone through menopause. And Dr. Leah Croll of Maimonides Health is here to tell us all about the breakthrough. It's nice to see you, Dr. Croll. Thanks for being with us. And this is a significant breakthrough. Addie's been on the market for other uses for a while now, but the FDA has now approved it for a broader category.
Yeah, so Addie is a prescription for low libido in women. Back in 2015, it was approved for use in premenopausal women. Now we're seeing it used in postmenopausal women up to 65 years old. This really is a big deal for a group of people that's been told that symptoms like low libido are just something they have to deal with as they get older. Of course, now we know that's not true. There is something we can do about it. So what sets this medication apart is the way it works. It's not hormonal. It's not a female version of Viagra. It actually works on the brain chemicals dopamine and serotonin to stimulate the desire pathways in the brain. So you can think of it like the desire pill. Now, important to know, it's taken once per day. Does have some side effects, especially sleepiness and dizziness, and you don't want to mix it with alcohol because that can cause low blood pressure and fainting.
The desire pill, that's kind of an interesting name. How would a woman know if this is something she should consider going on?
So Addie is meant to treat something called hypoactive sexual desire disorder. And what differentiates that from plain old libido or low libido is significant distress, meaning that if a woman has low libido and it bothers her, it interferes with her life or makes her relationships more difficult, that would be a reason to get checked out, see the doctor about it. Now, this is very common in postmenopausal women. 1 in 8, or about 12%, will suffer with this. So really a lot of women affected by this, and what the FDA is doing with this approval is validating their concern that this is a legitimate medical problem that deserves legitimate medical treatment.
Yeah, and speaking of validating, there really wasn't. So much of my youth, none of this was a part of the conversation. We barely said the word menopause, and now it's really more front and center. As a doctor, you have to be hearing from more and more patients on this as well.
Absolutely. We're in a moment of real reckoning within the medical community in terms of how we approach menopause and talk about it with our patients. It's been really amazing to see, and I think the big message here is that menopause is not the end of sexual health. It is not the end of women's wellness. Women deserve to have conversations. They deserve to have options, and that's what makes Addie so great. It's another option that we can add to the toolkit. Of course, we've talked a lot about hormone replacement therapy recently, but that is not going to address low libido necessarily. So to have this other option to be able to personalize medicine for these women is a big, big deal. And I hope that women are feeling more empowered than ever to
maybe
talk to their
not
doctors.
embarrassed or shamed.
Absolutely.
Now that we are talking about it more.
Dr. Croll, thanks so much for being with us.
Thank you.
Coming up here, we are celebrating